We are going to few important simple X-rays I am going to show you, which are commonly you will get in your practice and in your exams you get those. We get the here. This is the one which is a view, AP view of shoulder joint, and this which is giving the all the head of humerus, glenoidal cavity, and clavicle, and we have the ribs. This is the normal shoulder joint X-ray, plain X-ray. At least you should able to understand or find the this reading in the X-ray. Next. So what we are going to see in this, here we have to see the medial border of the scapula, and here we lateral border of scapula, ribs and clavicle. Here you have the humerus and all. And these are the things where we can see in the shoulder AP view. So AP view in the shoulder, you are going to see these all areas, and these all are the structures you have to identify. Next, when you take the arm X-ray, these all are the plain X-rays, which is you have to see the head of humerus or the upper end of the humerus. Then we have the shaft of the humerus, lower end, including all the lateral and medial epicondyle, and we see the left side of the thorax. So that you can see the left ventricle shadow, left lung, and we have seen the all the shoulders joint structure, including the arm, that is the humerus. Going to the elbow, this is the one where we can take the AP view. You can see the lower end of the humerus, upper end of the radius and ulna. Other parts where we can, you studied in the osteology, that you have to correlate here, or you have to see the parts on this. So here olecranon process, and you have to medial epicondyle, lateral epicondyle. If such X-ray is not coming like this labeling, it is all labeling I have given. This is to identify what are the parts you have to identify in the X-ray. So that is a very important thing which is you have to mention when you are reading or seeing the plain X-ray of arm or the elbow. Elbow joint, which is a lateral view. Different views also there. You can concentrate on the views also. So lateral views where we can see the radius ulna and lower end of the humerus, all parts which is we can see in the lateral view of the X-ray, that is the elbow. When you see in the exam, sometimes there may be the examiner insisting some pathological or abnormal things can be presented. That time here you can see the radius ulna shaft fracture. So you are going to get in this highlighted, it is not straight bend. You are going to see the lower end of the, that is the radius, and here we have the fracture side of the, that is X-ray taken forearm, then fracture of the shaft, radius and ulna. So this is the one plain X-ray which is forearm in the AP view and lateral view. You will get in your clinic and by the patients in two views also. Simultaneously in one, that is a film or one paper, it may be printed. So this is the one which is you can read. So this you have to see previous X-ray what is shown. There you have to see the, all these regions, but here I have told the shaft fracture, radius and ulna fracture which is there. So that is you have to see, and other parts which are seen in the X-ray, that is lower end of the humerus and total elbow joint structure, wrist joint structure, and we have the radius and ulna. So these all are the AP view forearm which is highlighting the elbow and wrist. So this is the one which is you have to forearm plain X-ray. When you take the X-ray of the hand, where you can see the all 7 or 8 carpal bones, 7 tarsal bone in the foot. So all identifying these all bones are very important. hook of hamate, you have to find out in the X-ray. Then other, which is are the carpal bones 8, you have to identify, which is a proximal row, which is a distal row, from medial to lateral, lateral to medial. If you study this in the anatomy, as since from my anatomy reading, as basic terminology used, that is a C looks too pretty, try to catch her. According to all these synonyms, we can, that is a scaphoid to the all trapezius, trapezoid and trapezium, scaphoid, all these 8 carpal bones which can be remembered. So we highlight metacarpal and phalanges. In the phalanges, you have to see distal, midline, proximal phalanges. That you have to concentrate, and all the 8 carpal bones, lower end of radius and ulna. So when we want to see the vertebral column, which view we are going to? I have told in the first, we want to visualize the posterior part structures of the human body in the thorax. We want to take the AP view. Then anterior aspect, that is the PA view. So here you have to see all these vertebrae highlighted. So clavicle is the first rib you have to see. Then tracheal bifurcation. Then we have the vertebral bodies, all T1 to T12 vertebrae are presented in the total plane X-ray. So this is a very important one, which is you have to remember. This is the AP or PA. Usually don't tell that is a wide chest X-ray, which is I have shown. That is the AP view. That is commonly we go. That is a PA chest you have to. Without mistake here, AP view of chest you have to remember. So lumbar vertebrae, you can see all the, we have taken the anterior posterior view. This is, we are going to see the lower upper part of the pelvis and lower part of the rib cage and these lumbar vertebrae. For the X-ray, simple X-ray for the lumbar vertebrae. Pelvis, when we take the plain X-ray of pelvis, you have to see the most important joints, regions, pubic symphysis, sacroiliac joint. You may go for the sacrococcygeal joint. Then you can see the parts of the hip bone, ilium, pubis and ischium, ischial tuberosity, and this is the head of femur, then neck, and concentrate on the neck shaft angle. If it is a 125 degree, that is a neck shaft angle, greater trochanter, intertrochanteric crest, anteriorly we are going to get. So this is pubic symphysis and normal, which is a plain X-ray, and joints, and this is a 5th lumbar vertebrae. This is showing the, that is the pelvis. So pelvis is formed by the 4 bones and 4 joints. That you have to remember. So going forward, we are going the radiographs of the lower limb, where in that I have covered the pelvis. When we go for the hip joint here, thigh region, which is covered, femur, plain X-ray, AP view. In this, we are going to see the hip joint. Then we are going to see the almost all the part of the head, neck, greater trochanter, lesser trochanter, and shaft. And in the part which is covered, ischial tuberosity, and here acetabulum, and we are going to get the fovea capitis of the femur. So these all representing the AP view of the, we are going to get the thigh, maximum highlighting the hip joint. So this is the one which is we have come across. Going for the knee joint PA, that is a AP view of the knee. We can see the lower end of femur, then tibia and fibula. So what you can see here, that is a medial condyle, lateral condyle, then intercondylar eminences which are present on the tibia, that is superior surface of the tibia, which is having the intercondylar eminence, intercondylar tubercle. Those you have to see, and space between the 2 bones. Very important. Then arthritis patient, all synovitis patient, all you have the, if you know normal this, then only you can diagnose the abnormal. So here arthritis, chronic arthritis, knee joint, that time you have to see the space in between the 2 bones. Then we have in this is meniscus, That is a cushion between the two bones, lower end of femur and tibia, that should be seen. So this is the one which is a plain X-ray, which is you can remember. Next, this is the lateral view, knee joint, as I have told, patella. You want to see the fractures of patella. Many maximum fractures and dislocations are relating to the fracture of patella. So you have to see the lateral view of knee joint, lower end of femur, upper end of tibia, fibula and patella. So this is the one which is, if you know what is the patella, where it is situated, what are the ligament attached, what are the muscle which are attached to the patella, insertions muscle which are quadriceps femoris we call, vastus lateralis, medialis, intermedius, rectus femoris. So these all we have to remember, which will be relating to the locking of knee and unlocking of knee muscle. So locking muscle of knee is what? Which is the locking muscle of knee? Quadriceps femoris. And unlocking is a popliteus muscle. So this will be asked in the exam, which is a locking. What is locking of knee? It is the medial rotation of femur on tibia during terminal stage of, that is a flexion or extension. Flexion. It is a medial rotation of femur on tibia during terminal stage of flexion. Locking, that will be the lock, is a lateral rotation of femur on tibia during the initial stage. We are going to last stage, terminal stage of extension. So then onwards we don't have any movement. So locking, unlocking, what is a locking muscle? Unlocking you have to remember. In the leg, how you are going to get the radiogram? You are most important bones, tibia and fibula. So what you are going to get? Medial malleolus, lateral malleolus, and we have the condyles of the tibia, head of fibula. So in the fibula you have to remember, comparing to the tibia, the fibula is a thin bone. Maximum which are the fractures are seen with the tibia is fibula is maximum common because it's a thin shaft of the tibia, that is the fibula is molded. It is no definite shape. So that is molded by the muscle attached to it. So that you can see the fibula and tibia where you can take the radiograph of the leg. So ankle joint, very important. Commonest clinical condition, we get sprains and strains of the ankle. You are not going to diagnose, you are not going to get any pathological changes in the plain X-ray when you are going to deal in the sprains and strains of the ankle joint. And it is has to be treated by the all practitioner, all homeopaths, because it is given by whatever the normal advice is and supports and movements, exercises. On that you can you can reduce the complaint. So we have the strains, sprains, either dorsiflexion or plantar flexion, then eversion and inversion. So this will be causing the sprain. So that time very important, you have to remember about the ankle joint, that is the structures of the ankle joint you have to see. Foot region, lateral view, plain X-ray. What you can see here, we are going to get the 7 tarsal, 5 metatarsal, 14 phalanges, calcaneus bone. So we have the common complaints in the applied anatomy, that is a heel pain. So growth of the bone or some things which is we are going to get, that you have to see the normal calcaneus bone. Then only you can identify. Then we have the talus, socket of the all this forming the ankle joint. Then all these are the 7 tarsal bone. That we can, mnemonics we can use, cut the nose, make it like a cat. With that mnemonics you can remember the all 7 tarsal bone. As I have told, carpal bones, remembering mnemonic is the, she looks too pretty, try to catch her. So these all things which is we are going to get in the lateral view. So this is the one which is a superior view where we can take on the all these. Specifically we can see the first metatarsal to the fifth and phalanges, and these all are the, we are going to get the 7 tarsal bones. So this is the one which is you can highlight. You can take when there is enough fractures of phalanges, metatarsal, tarsal bones, and I have told the sprains and strains of the ankle. That time you can remember. This is the one which is, which view this is?
Lateral.
Lateral view. Which area? Lateral view of skull you can call this, or lateral view of brain you are going to call. Okay, because it is a plane where you can see the lateral view. What are these structures of the body? These are the ornaments which are given. Don't find out this. Wear earrings and all. So this is a test of doctors. Old patient is better than new doctors. Old patient is better than new doctors, it is said, because who is patient, he knows all, everything, medication, medicine, its side effect, dose, everything. New doctor is not knowing. Sometime. I hope that is you should be the intelligent and knowledgeable, because I have asked you, just patient will brought this X-ray and ask, sir, this is a hole in my neck region or whatever. Sometimes they will ask you, what is this? No, you have to see. I have told in the first 2 slides of my lecture, there is a metals or ornaments which are made by the metals. They also give the shadow, radio opacity. So these all you can see. And this is the one which is normal. You can see brain, cavity, meninges, and all. You can see the frontal sinuses. Frontal sinus, we have the sphenoidal, ethmoidal, here maxillary sinus, and upper jaw, lower jaw, and this is the one lateral view. When head injury and everything is there, that time we advise lateral. Okay? So anterior view, how you are going to see skull when we take the head, anterior view, what you can observe, you are going to get the nose, eyeball, eye socket. So all these bony parts where you can, cranium, so all lower jaw, upper jaw, which is should be seen. And you can see here, that is a frontal sinus. So that also you can see. Next. This also wanted to see the deviated nasal septum. Nose applied anatomy where the nasal septum is there. Here we are going to get the nasal septum. We want to see, diagnose. In that we take the extended head anterior posterior view. That also you should remember. That is which is we can take the plain X-ray of head. On the occipital-frontal view, on the PA. This is also lateral, as I have shown in the first X-ray of skull. These all things you have to see, all the parts where you can study in the skull. So all in the different normas we have studied the skull. In different normas, if the skull X-rays are taken, you should be able to identify the different norma structures. So that is the one which is norma lateralis. This is one skull which is we are going to study. When we see the cervical spondylosis common, where we can see all the spines, where you can see the cervical spines. In the extended neck, where we see the lower part of the skull, upper part of the thoracic region. So these all you have to remember. And you have to find out what are the characteristic features of the atlas axis and 7 cervical vertebrae. So then only you can identify and you can diagnose the case. So this is the one which is a lateral view of neck region. What is this? Plain X-ray of abdomen, we call our KUB. Very important. Now we are going to the plane to the different important X-rays where we are going to get those. I am going to highlight few important things. If you get this X-ray, which is you are going to get, you can see the lower part of the thoracic region, pelvic completely, and abdomen. Here you can see the kidney shadow structures. So the very important all structure. So other structures we are not going to get here plain in that. We may go for the GIT highlighting, we may go for the perineal X-rays, and we want to highlight the kidney renal system, we may go for the pylographies. So those all we include in the contrast X-ray. But how it is different, I am calling this is the X-ray of abdomen or X-ray, plain X-ray of PA. That is a view where you can see the KUB, kidney, ureter, urinary bladder. You can highlight this also. So this is one simple X-ray where from my department we keep for the spotting to correlate with the pylography. I will highlight when you should remember this plain X-ray how it is, then you will understand what is the pylography. This is also same where highlighting the pelvis and all that you have to remember.